Okay. Did everybody get a chance to have something to eat and drink and go to the toilet? Yeah. Is there anything you want to ask me about the environment, about the training room? Anything that you're finding uncomfortable physically in the environment so far?
No, all good.
We're all good. Okay. Well, we will recap some of the considerations just because I think work health and safety considerations are really important to go over every session. So I just want to recap that the toilets are over here. Please feel free to go at any time. You don't need to ask me, just don't know where you're going. Mansia, I know that you may have to take phone calls or return texts during this session as well, that you have some ongoing operational challenges, and I understand that completely. If there's anything you feel that you miss because of having to be out there for an extended period, please let me know afterwards and I'll go back and make sure that I just one-on-one bring you up to speed with anything you might have missed. The emergency evacuation procedure is on the wall over there. I hope you've all had time to familiarise yourself with that. The exit is behind you and the muster points are in the car park. So just making sure, leave everything behind. In the event of an emergency, we'll all troop downstairs together and make sure we're safe, which is what all of this training today is ultimately about, especially the first two trainings. So, are there any questions about OH&S, work health and safety? No? We will be using these mannequins today to do the practical element of our assessment. So I just want to make sure you are aware that in between usages, I will have mannequin alcohol wipes so that we can maintain our hygiene, our personal hygiene. We also have the hand sanitizer over here that you're welcome to help yourself to at any point. And Katrina, we will be doing your CPR on the table so that we can make an adjustment for your current medical situation with your knee. How's it feeling?
No, it's fine. It's all good.
Excellent.
I had a bit of a stretch in the break.
Okay, good. That's what breaks are for. Excellent. All right. Has everybody got their phones off? Except for Mansia. Excellent. And as I said, if you didn't get a chance to finish your food during the break, feel free to have a snack, have a drink, candy. I just want you guys to be comfortable because I think the more comfortable we are, the more we take in the information that's being presented. Okay. Temperature okay for everybody?
Yep.
Great. All right. So, who can tell me what we learned in the first session?
Doctors A, B, C, D.
Doctors A, B, C, D. So to briefly recap that, D. R.
Response.
Sen. S. I gave you the answer. S.
Sense of help.
A.
Airways.
B.
Breathing.
C.
CPR.
D.
Defib.
What do we send for?
Triple O's. Ambulance.
Oh, you guys have got it. And what are the cows' questions?
Can you hear me? Open your eyes. What's your name?
Gold
Help
stars.
again.
Gold stars for everybody in the room. So I did want to recap that. The learning objective from this session is moving on from that to the C and the D of the Doctors A, B, C, D. So at the end of this session, I want you guys to be able to demonstrate an understanding of the differences in CPR when delivering to different population groups. So we're talking about an infant, less than 1, a child, which can be anywhere from 1 to say 12, 13, depending more upon body size. We use our discretion there. And then an adult, kind of 12 and 13 over. Because there's some very specific differences between the way that we deliver CPR in terms of the amount of pressure that we use and the amount of air that we're delivering. So we'll get into that in a moment. And I also have a handout for you for your reference. Now, in terms of the assessment requirements, we'll be doing again a little bit of question and answer, but the main assessment requirement in this particular module is that the learner is able to competently demonstrate CPR for that period of 2 minutes. Jodie, can I just check that we're definitely recording at this point? Because I would hate to have to waste your time and start again.
Yeah, all good.
Excellent, thank you for confirming that. Excellent. Now, at the end of the training, again, I will get you to fill out a feedback form, but you also have another form to fill in this session too. Because as part of the training, I'm going to take you through, after your scenario, filling in a risk assessment. Because I believe that in your roles here at Nepean Aquatic Centre, each and every one of you would have a situation where you probably have to fill in a risk assessment, because as leaders in the business, you'd be leading the teams that deal with those on the ground. So if you guys know how to fill in a risk assessment, that's a really good step towards completing this part of the workplace training. Okay? Excellent. Right, just making sure we're keeping to time because I know that I like to talk. All right, I'll try and keep this on track and on time. So, CPR. Who knows what CPR stands for?
Cardiopulmonary resuscitation.
Say that a little bit louder for me, Natasha.
Cardiopulmonary resuscitation.
Pulmonary.
Yep, that's it. Resuscitation.
Resuscitation. I'm going to grab my red whiteboard marker because this black one is a little bit probably hard to read from a distance, so bear with me while I do that. Excellent. So, we're going to take a trip down memory lane and I'm going to take you through some of the history of CPR before we get on to CPR itself. So as you know, in the event of a cardiac arrest, time is crucially important. Life-saving interventions such as CPR quite often can literally be the difference between life and death. So, cardiopulmonary resuscitation, or CPR as it's more commonly referred to. Do we know how much more percentage, if we start CPR straight away, how much does that affect the outcome in terms of the person surviving? What percentage do you think?
70.
Not quite that high?
60.
62. Quiet? 50%. The person is twice as likely to survive a cardiac arrest if we start CPR within a good time frame. I'm skipping forward to defib as a comparison. If we use a defibrillator, a person is 90% more likely to survive a cardiac arrest. So that's why CPR and defib, I like to work together and teach them hand in hand because they really are the life-saving elements of the doctor's ABCD chain of intervention. Now CPR combines mouth-to-mouth ventilation and chest compressions and is performed when a person is unresponsive, not breathing, not moving, and no pulse. Now really interestingly, a couple of years ago when we had the global pandemic, a lot of people were really really reluctant to perform CPR with the breaths because of that risk of cross-contamination, and we're also frightened, justifiably, of COVID. So can you perform CPR as compressions only and not with breaths? Yes, that is definitely an option. So another couple of scenarios where that might be the case is, you know, horrible things to talk about, but that person might have vomit all over their face.
Yeah.
That person may have ingested some drugs and you don't know what's coming out of their mouth. That person, God forbid, may have been in a terrible car crash and not have the mouth, you know, with really broken teeth and things. So again, back to doctor's ABCD, we want to go back to the danger part and we don't want to expose you guys to any danger whilst performing CPR. Okay? Now, when we perform CPR, do you think we're actually trying to restart the person's heart? No. That's what a defib is for. Okay? And we'll go to that in a minute as well. What you're doing is making sure that blood-containing oxygen continues to be delivered around the body and to the brain. The mouth-to-mouth provides the person's lungs with the oxygen. The chest compressions keep the blood moving around the body to oxygenate the brain. Okay, that took me a little bit to get my head around when I first started working in this area. All right. So this life-saving action keeps a person alive until further assistance arrives and make sure they have the best chance of recovery when their heart is restarted. So, how long ago do you think maybe CPR started? Are we talking modern times, ancient times?
1910.
I was going to say 50s, but I don't think that's right.
Ancient Egypt.
Okay, there we go.
In ancient Egypt, the ancient Egyptians believed when somebody was unresponsive, if they hit them with a whip, that would revive them. And then when that didn't work, when that didn't work, they did eventually get to crude attempts at chest compressions. In the 1700s, we hung up people upside down to try and revive them. And in the 1800s, people tried tying the person to the back of a moving horse.
Oh,
For that, yes. So there you go. That's something I didn't know until I researched this. So
that's a fun little fact.
oh well, you know what? A little bit of history sometimes contextualises what we're learning, which is really, really good. Mouth-to-mouth breathing was first used in the 1700s, so much closer to what we would have thought. And then in the 1880s, chest compressions were added by some English physicians. The first time that was actually called CPR, the combination of mouth-to-mouth breathing and chest compressions, was in the 1960s, and the American Heart Foundation formally coined the term CPR, just to give you that little bit of background. Now, training in CPR has been happening all over the world since this time. Initially in Australia it was only for medical professionals, doctors, paramedics, nurses, but now we do encourage the general public. However, what percentage of the general public do you think know how to do CPR or have ever done a CPR course? 50% of people have ever done a CPR course. However, 90% of those did their course more than 5 years ago.
It's crazy.
So some people do it once and then never again. Now, speaking personally, from my point of view, sorry, I probably should have introduced myself a little bit better at the beginning. So I've been working in this area for about 10 years now, and I'm learning things all the time, and I try and put different anecdotes into all of my trainings. But I think it was really after I'd done the 5th or 6th, for me, slow learner maybe, annual update, is when I actually started to feel confident that if I was faced with that situation, I would know what to do straight away and have doctors A, B, C, D in my head and not have the adrenaline take over. So hands up if this is your first CPR training. Hands up if you've done between 2 and 5 trainings. Hands up if you've done more than 5 trainings. Okay, for the people that have done between 2 and 5 trainings, do you think you'd feel very confident to respond to a CPR emergency? No. Okay. For the people that have done over 5 trainings, do you feel that you'd be very confident responding to a CPR emergency?
Yep.
Nice, okay. So that's a really, just in this small sample group, that's a really good indication that we need to do this annually. I know it's a requirement of your work, but I think it's really important to continue to encourage the general population to continue to do their CPR updates, okay? And it's largely voluntary in this country. I mean, I know for teachers and aquatic professionals such as yourself, it is a mandatory requirement, but as much as we can encourage the people around us to be proficient in CPR, the better it is, because as we said, we have a 50% chance better survival if we know CPR. All right. Let's go through some of the theory of what CPR actually means. I'm going to give you a song sheet to sing along with. I love a resource. I love a printout. So again, I'd really encourage you, like the doctor's ABCD chart, I printed it in colour so that it's pretty and easy to follow. I'd really encourage you to print and laminate that if possible and keep it somewhere where you can refer to it easily in an emergency situation, or even just, you know, with your morning coffee, especially the people that have done 5 or less trainings, to really feel confident how we can respond in that situation. Okay. Jodie, can I just borrow yours for a moment? Thank you. Okay. So let's move over to the other side of the board. I'll give you a minute or two just to read through that, and then we'll recap the main points. Pop the handout back in your lap when you've finished reading. Everybody finished reading through that? Excellent. Now, one thing I think I could probably work on is my handwriting. So whiteboard handwriting is definitely a skill that I'm still trying to acquire. So infant, child, adult, the amount of compressions, the amount of breaths, depth of chest, tilt of head, and the force/pressure. So if you guys can turn your sheet over, because we're just going to test a little bit. I know not everybody learns in a written information way, which is why I really want to support that with some question and answer and learning visually here. So in terms of compressions, what's the magic number? 30. Is that for adults?
Yep. Yes.
What about children?
Yep. Yes.
30. And what about infants?
Yep. Yes.
Excellent. That's right. Now in terms of breaths, how many breaths do we give? 2. 2 for infants, 2 for a child, and 2 for adults. I just want to talk about the breaths with infants. Think about the size of an infant's lung, okay? So we just want to really fill our cheeks, and that's really all that we need to put into an infant. The air that will go into your cheeks is the little puff that we should put into an infant's lung, okay? Otherwise we run the risk of permanently damaging their lungs by pushing too much air into there. So that's something to really think about. In terms of delivering breaths to adults, really important to open the airway by tilting the chin all the way back and making sure we have a seal around the nose and the mouth. Alternatively, pinching the soft part of the nose. I say it like that so you remember it. And tilting the head back and making a seal around the mouth. This is our pistol grip, okay, like a gun, to really tilt the head back. I'll show you on the dummy in a moment as well. Take a breath, place your lips over the patient's mouth, ensuring a good seal. Blow steadily for about a second and watch the chest rise. Turn your mouth away from the patient's mouth and watch for signs of being air expelled. Maintain that head tilt and chin lift and go back and give a second breath. That is now your 2 breaths. If the chest doesn't rise, recheck your seal around the mouth and recheck the airway for any obstructions. Make sure the head is tilted and the chin's lifted and make sure there's a good seal around the mouth, and then go back to your CPR. 30 compressions, 2 breaths. Let's have a little look at that on the mannequin. All right, so make sure when we do our practical demonstration, hands right on top of each other. Think butterflies, how we teach it to the children. Nice strong arms. We don't want to lock the elbows, but we want to make sure we have the full force. We want to place our chest, our body, over the patient with our knees next to the patient. We want to make sure when we're practicing we don't do it here, because in real life their legs would be in the way. So right to the side, right in the middle of the chest, and we start compressions. And this is what I'm going to have to get you to do for an assessment for 2 minutes and go through so that everybody gets a chance to practice that. Okay? Now in terms of speed, who can tell me how quickly we give the chest compressions?
To the song of Staying Alive.
To the song of Staying Alive?
Baby Shark.
Baby Shark for a more updated version, or Another One Bites the Dust is a good one. And a lot of people refer to the Macarena. Ba, 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 ba. That's the same rhythm here. You don't need to know the dance, just giving you the rhythm. Okay, so timing is really, really important. All right, in terms of depth of the chest, what are we looking at? 1/3? And is that for everybody?
Yes.
Yes, that's right. So far, I think it's really important at this point to draw a line and realise that nothing changes. Up until these final columns, 30 compressions, 2 breaths, and a 3rd chest depth. If that's what we keep in our mind from today, that is the most important part of this learning. Everyone still with me?
Yes.
Any questions? Okay, I'll keep going. We're about a minute away from a 30-second break while we reset the camera, okay? In terms of tilt, for an infant, really important to note, their neck hasn't yet finished developing, so we want to maintain 0 head tilt, okay? And that might mean that we deliver CPR on a table, on the floor, or even on our arm because of their minimum weight. And we're just using 2 fingers. So same thing, less force, less pressure, 30 and 2. The breaths, tiny little puffs as we spoke about, and you can put your mouth over their nose and mouth to create that seal rather than try and make a really little seal around a really little mouth. Okay, so keep that in mind. All right, so no head tilt. And how many fingers?
2.
Beautiful. All right, child. Any idea, because how can you use the same head tilt for a 13-month-old as you can to a 13-year-old? So any idea what we might do depending on the sliding scale of how old they are? Any ideas? Exactly. So depending on how old they are, same pistol grip, 13 months, tiny, nearly 13, nearly an adult, nearly full head tilt. Use your discretion there, okay? I'm just going to put here dependent. It's not even on age, it's dependent on size. And how much pressure or force do you think we'd use? 1 hand, exactly. So 1 hand, exactly the same. Putting your body over, don't lock the elbow, full weight of your body, because it's really tiring. You'll find out when you're doing the 2 minutes, it's really tiring. And 1 hand. Adults, how much head tilt? Full. And how many hands? Both hands, full pressure. Now I just want to talk very briefly before we break for 30 seconds about how exhausting it is. Now you think that adrenaline's rushing through your body, and in the last training session we had a scenario where an ambulance took 22 minutes to come. When do we stop giving CPR? When the ambulance arrives and we can hand over to somebody who's more highly trained than us. What's another scenario? When you physically can't do it anymore, because if you're about to keel over, that's not a good outcome for anybody. That's back to the danger in doctors ABCD. Or what's the third scenario?
When someone comes in and takes over from you.
When somebody comes and takes over, yeah.
If
or
they're pronounced dead by a medical professional.
if a medical
But,
professional
yeah,
pronounces
it's
them
not-
as dead, we don't continue.
Yeah.
We go into debriefing counselling for everybody concerned. So, Jenny, can I just get you to come down here and show me how, in the event of somebody getting very tired, we would communicate really well and swap in, okay? So I'm going to use a scenario where I've just done my 30 compressions. I've given 2 rescue breaths with my full head tilt because there's an adult here in pistol grip, pinching the nose. Breath, listen, breath, listen. And in today's practical, I want you to do exactly as I've just done there. Pretend to breathe, listen, pretend to breathe, listen, so that we're not putting our mouth on the dummy themselves for hygiene reasons. Everybody all right with that?
Yeah.
And practice on your partner, the mouth seal when you get home, if you feel you need to practice that element. What you do in your own time is your business. So communicating really well is important. So I'm going to talk to you during this, and while I'm finishing my compressions, Jenny, I'm getting really tired. I'm still counting here, or you're counting while I'm talking, either or. And I'm going to say I'm going to finish these 2 breaths, and then I'm going to get you to swap in. Is that okay with you, Jenny? Sure. Okay, 29, 30. Full head tilt, breath, listen, breath, listen, and watch for rise of chest. Your turn, Jenny, in you go. You tell me when you've done enough CPR, and I'll swap in. Okay, does anybody have it? You can stop now, Jenny, for now. Save your energy for the assessment.
I was waiting to keep a breath.
Save your energy for the assessment. I'm just going to have a little 30-second break to reset the camera, but at this point, does anybody have any questions before we move forward? Okay, but while we, sorry, anybody? I didn't give you much of a chance.
I have one.
Yes.
Okay. Say we're doing a head tilt on a child who's larger, would we then modify to use 2 hands? Because at that point, will we need more force in the chest?
That's such a good question. They do say child up to 13, 1 hand. I would instead modify the pressure.
Okay.
So, but if you find, if you're a smaller person, if you're a 40 kg, again, there is a little bit of grey area here. If you're a 45 kilogram woman and you're working on an 80 kilogram teenager, Common sense to me would say, I'm not going to be able to deliver enough pressure with one hand, so we can then modify. So there are some grey areas there, depending on body size, strength. So these are really just guidelines to work within and use our, I guess, discretion and common sense when it comes to it. That's a really good question. Anybody else? Okay, shake it off. I'll be back in 20 seconds.
When we did our CPR
I didn't know if you wanted a question.
Yes.